Clinical trials are an important way of developing or improving treatments for blood cancer. But finding and enrolling on a trial is complex and can be overwhelming. In this special report for Blood Cancer UK, we find out about the unique support service they provide to help navigate patients and their families through the entire process.
Ella was an absolutely incredible person. She was a really beautiful person inside out, and she just got an absolutely infectious love of life. She loved animals, she loved outdoors, she loved nature, she loved keeping fit, she loved good nutritious food, she loved travelling. She was a passionate artist and she graduated in 2019 from Newcastle University with a degree in fine art with the plan to spend the summer travelling in Colombia and then go down to London with her partner Connor. While she was there, she was diagnosed with Ph positive acute lymphoblastic leukemia. She was in ICU in Colombia for a week and then was transferred back to the UK, where she had 2 years of unrelenting treatment. She was 22 when she was diagnosed. But despite all of that, her love of life didn't change. She lived every day with positivity. She always had hope.
After 70 rounds of chemotherapy and a range of standard and experimental treatments failed, Ella was given weeks, maybe months to live.
Kevin and I, and Tasha and Connor couldn't and wouldn't accept the news. As a parent, when you're given that news, it's not something you can accept, you can believe, but we were determined to find something somewhere in the world that could at least give us hope.
Ella's parents and sister Tasha set about the complicated process of looking for a clinical trial for Ella to join. Finding a clinical trial can be a confusing minefield, and most people don't realise that you do have the right to ask what clinical research is suitable for you. And yet, less than 30% of cancer patients say that they had clinical trials discussed with them. That's why Blood Cancer UK have set up a service to help people navigate the process of finding and going through a trial. They called it the Clinical Trial Support Service, and it's the first of its kind in the UK.
There are a lot of things to think about when joining a clinical trial, and there are a lot of challenges. This is why we work with that patient to figure out what would be best for them and figure out what the benefits are versus the current treatment that they're on.
In 2011, Sarah was diagnosed with chronic lymphocytic leukemia. Several years later, she started a clinical trial, and the results were swift.
Before I started treatment, I had visibly enlarged glands in my neck, and within 4 days, the lumps were visibly reduced. It was kind of amazing to observe.
And what would you say to anyone who's thinking about doing a trial?
A clinical trial is very much worth exploring as an alternative to traditional treatment, especially with help and support of Blood Cancer UK Clinical Trial Support Service, and in consultation, obviously, with your oncologist. And I was lucky because it immediately worked for me and the benefits were enormous. And of course, it doesn't work for everyone, but it is definitely worth exploring.
For Helen and the team at Blood Cancer UK, clinical research is the only way to break new ground in improving therapies for people with cancer.
Clinical trials look at treatments that are brand new treatments. They look at treatments that we've already got in existence, and we need to make those treatments better for patients because some of them are still not good enough. And the other reason why clinical trials is so important is we also get to look at how we can actually stop blood cancers in the first place. So unless we have people involved in clinical trials, we cannot progress and we cannot find kinder, better treatments than what we currently have.
Eventually, after a complex process of trawling the world for trials, the Dawson family did find one in the US, and they approached Helen for support.
She really helped us navigate the whole world of clinical trials, which without that, we probably wouldn't have got stage one because it was completely a new area for us.
Yes, that's something we can help you with.
Helen was on the phone constantly to me. If I wanted anything, she would be there. She also understood the human decisions, the agonising human decisions we were having to make, to talk through those about was this the right thing to do for Ella. And she was a great sounding board and actually understanding those human issues.
The day came for the family to board the flight to America. But as they were leaving, they got the shattering news that Ella's cancer had got worse and she was no longer able to join the trial.
And that was really cruel and really, really hard. And we knew at that point what that meant. That was the last hope gone. And unpacking Ella's suitcase was just so hard. Just a few weeks before she left us, we were sat as a family painting tiles, and we were all painting flowers and mountain scenes, and Ella painted a tile that said "Forever Grateful." And that's Ella. That's our beautiful Ella.